So this talk is entitled The Role of Immunity. I'm so glad to have you join us today. For those of you who don't know me, I'm Dr. Trish Murray of Discover Health Functional Medicine Center. I'm a physician, I'm a best-selling author, and I call myself the Health Catalyst Speaker. So what is the immune system? Well, the immune system is a complex, folks, network of cells and different organs that defend your body or each of our bodies against infection. Some of the different parts of the immune system consist of white blood cells, antibodies, something called the complement system, also the lymphatic system, the spleen, bone marrow, and also the thymus. Now, we can sometimes hear and feel the beating of our heart. So, you know it's working. But the immune system is actually silent. So even though we are much less aware of our immune system, it is working, folks, 24/7 to protect us from thousands of potentially deadly attacks every day. It acts as our military defense system and is constantly working and always on duty by constantly scanning our internal and our external environment to identify anything foreign as either friend or foe. So let's examine the different lines of defense used by the immune system to protect us. Now, we're going to go through quite a bit of information during this presentation. And what you see on the slide here is an image of the cover of my first book. And in this book, I cover the immune system and how it works as well. So if you are interested in being able to read through the information at your own pace, be sure to get my book. Now, Make a Dent in Chronic Disease. In order to order it, all you have to do is go to the shop of my website, and the address for my website is discoverhealthfmc.com, and click on the link that will take you directly to Amazon so you can place your order. So let's get into this. The first line of defense is known as your innate immune system. This is a range of protective mechanisms we are all born with. The innate immune system provides non-specific protection against various pathogens such as viruses, bacteria, fungi, protozoans, and worms. A number of defense mechanisms serve the innate immune system. These include things like physical barriers, such as our skin, chemical barriers, such as antimicrobial proteins that harm or destroy invaders, and cells that attack foreign cells and our own body cells that are harboring infectious agents. And before moving on to the second line of defense, let's delve a little deeper into the defense mechanisms of the innate immune system. The skin, as an external barrier made from layers of cells serving as protective barrier to infection. Not only does skin provide a protective barrier to keep invaders out, but it also secretes fatty acids and enzymes. For example, the fatty acid oleic acid can kill certain bacteria, while another enzyme called lysozyme can break down the outer wall of certain bacteria. Internally, mucous membrane linings of either the respiratory tract, the gastrointestinal tract, and your genitourinary tract, your urinary tract, also provide a protective barrier that are constantly being renewed. The membrane of all of these different areas act as a barrier and trap small particles to prevent them from getting into any one of these particular organ systems. Mucus, mucus which can trap bacteria and small particles, is another form of protection. Another is actually the level of acid in your stomach, which has an extremely acidic pH of only 1.8. If you're familiar with the pH scale, neutral is 7, 1 is extremely acidic, and 14 would be extremely what's called basic. So if our stomach's optimally pH is 1.8, you can see by that scale that this is an extremely acidic environment, and it's another example of your innate immune system at work. Your cough reflex or sneezing are also examples of mechanisms of innate immunity that is not specific to any one type of invader, but a global protective reflex. Another crucial aspect of innate immunity is chemical barriers to infection. When microbes or bacteria or other types of bugs penetrate the body's protective barriers and enter the internal tissues, they encounter a variety of chemical substances like enzymes that are special proteins that attempt to destroy the invader, or at least prevent that invader from growing or getting a strong hold within you. There are many mechanisms by which chemicals work to harm or destroy invaders. For example, the typical white blood cell is called a leukocyte. Leuko is white and cyte is a cell, so the white blood cell. But they are more differentiated than this in the innate immune system. There are white blood cells that are called natural killer cells, also mast cells, eosinophils, basophils, and phagocytic cells. That's a complicated word, but the phagocytic cells actually can engulf or ingest or swallow a foreign invader and then have chemicals within themselves to destroy or neutralize that invader. They then can even take a signal from that invader and place a receptor on their own cell membranes that will go on to educate the immune system's second line of defense, called the adaptive immune system, what to look for. The names of some of the phagocytic cells, more specifically, are called macrophages, neutrophils, and even another name called dendritic cells. Now, an early induced response is another process of the innate immunity. And inflammation is an awesome example of one of these early induced responses of the body that occurs through the innate immune system. Now, most are familiar with this response of inflammation, but may have only heard of the dangers that inflammation can pose. But acute inflammation that occurs in response to an infection can eliminate infection, or at the very least, hold an infection in check until specific second lines of defense, called the acquired immune responses, have time to develop. Infection often results in actually tissue damage, which may trigger the inflammatory response. And as you know, the signs of inflammation include pain, swelling, redness, and fever. And these are induced by chemicals released by certain cells called macrophages. Now, acute inflammation is a healthy protective immune response. However, when inflammation becomes chronic and doesn't shut down and does not quiet down in the body, this then can become dangerous and cause chronic diseases to develop. That's when we want to be concerned. when inflammation becomes chronic. Now, the second line of defense is called your acquired immunity. Acquired is named as such because you are not born with this form of immunity. It is acquired through, how does that happen? Well, you're exposed to a foreign invader throughout your life, and these invaders are called pathogens. And the acquired immunity, this line of defense, is acquired from exposure to an infection or disease, or you also could be exposed to another person's antibodies to initiate acquired immunity. Now, it is well established that persons who contract certain diseases or infections and survive generally do not catch those illnesses again. And this is made possible through the mechanisms of your acquired immunity. When your immune system is exposed to a pathogen, it learns to recognize it and can make your immune system better equipped to fight off that particular type of germ the next time you're ever exposed to it. Many times, it's the cells of the innate immune system that within typically about 4 or 5 days of an infection are the first line of defense against that infection, but then they train the reinforcements of your adaptive immune system, what to look for, and then once trained, your adaptive immune cells attack the invader as well. Now, the adaptive or acquired immune system response can include B cells, which create antibodies, helper T cells, and cytotoxic T cells, and it typically involves the creation or training of your adaptive immune system, or your acquired immune system has 4 phases to it. First, encounter. Second, activation. Third, attack. And fourth, memory. The acquired immunity is dependent on specialized white blood cells, but these white blood cells are known as lymphocytes. Lymphocytes are the cells responsible for the body's ability to distinguish and react to an almost infinite number of different foreign substances. The cells of the adaptive immune system, once activated, can be trained into one of 2 primary pathways, or if you will, branches of your military. In the same way that a soldier can enlist in either the Army, the Navy, or the Air Force, an adaptive immune cell can be enlisted into one of 2 primary branches of your adaptive immune system. It can go down a branch called the Th1 pathway or branch. And this Th1 branch activates T cell mediated activation of macrophages and neutrophils. Whereas the other branch is called the Th2 pathway, and that activates B cell mediated activation of eosinophils and basophils. Now, if your adaptive immune system becomes hypersensitive or overreactive and it doesn't know to quiet down, this can initiate what's called an autoimmune reaction, or a reaction against self. In other words, against your own tissues. You see, if this hypersensitivity and dysfunction happen in your Th1 branch or adaptive immune cells, then certain particular autoimmune disease processes will develop, such as rheumatoid arthritis, multiple sclerosis, Crohn's disease, or even thyroid-related autoimmune conditions like hypothyroidism or hyperthyroidism. Either one is down the Th1 branch of your immune system. Now, the other branch, the Th2 branch, if that becomes hypersensitive and dysfunctional, then you have more allergy-related diseases, such as asthma, eczema, or psoriasis. Now, lymphocytes originate from stem cells in the bone marrow, and they can travel and multiply in response to an appropriate stimulation. Now, I mentioned before the term T cells or B cells, and these are referring to different types of lymphocytes. Both T and B cells recognize and help eliminate foreign molecules, but they do so in a different way. Lymphocytes are distinguished from other cells by their ability or capacity to recognize foreign molecules by means of receptors. A receptor molecule is a special protein whose shape is designed to fit foreign molecules, like these molecules as a key that fits into a lock. So think about a receptor and these are the idea of the fact that on a cell membrane there could be receptors, or there can be areas where these keys will fit into different locks and cause a response. Now, any foreign material that binds specifically to a receptor molecule is called an antigen. Antigens include molecules found on invading microorganisms such as viruses, bacteria, protozoans, and fungi, as well as molecules located on the surface of foreign substances such as pollen, dust, or even transplanted tissue if someone's had to have an organ transplant. Remember, these receptors can be on also those phagocytic cells once they have killed an invader, and the purpose of them is to train the adaptive immune cells, the lymphocytes, how to identify the foreign invader. One of the many incredible abilities of the immune system is that it keeps a record of every microbe it has ever defeated or killed. This enables the immune system to recognize and destroy the microbe quickly if it ever enters the body again, before it can multiply and even make you feel sick at all. However, some infections like the flu and even the common cold may have to be fought many times. And the reason that is because there are many different strains of sometimes the same virus, and each strain is different. And each strain has to be dealt with first by the innate immune system, and then by the trained secondary adaptive immune system. Therefore, catching a cold or the flu from one virus does not give you immunity against all viruses, or even different strains of the same virus. And we've all seen this with COVID. COVID is a virus that has developed many different strains, Omicron and Delta and so on. And so that's why some people can get COVID, multiple times, because it's not the same strain each time you may have had that type of infection. So let's give you an example. So let's say your child or grandchild comes home with a cold, which is a virus. And sometimes you do not get sick at all. And other times you just might have a slight sniffle for a few days. But other times you're laying right next to your child or grandchild and you're just as sick as they are for as many as typically 7 to 10 days. That's how long, 7 to 10 days is how long it takes for first your innate immune system to attack an invader and to do what it can to keep it at bay. And 4 or 5 days in, it then is able to, within that time, train your adaptive immune system what to look for and to come in as reinforcements. And within the next 3 or 4 days more, so 7 to 10 days total, typically, you eradicate the whole virus. So this whole story is because your immune system may have seen the virus before and reacts immediately with full memory of the virus, and you either do not feel sick at all, or you only get the sniffles. But if you are just as sick as your child, you have no memory of that specific strain of virus, and both you and your child have to first go through the innate immune system responses that occurs again for the first 4 or 5 days. And then once the adaptive immune system is trained, it goes into action. It's as your reinforcements, and then helps fully destroy the virus and eradicate it from your body. Now, record keeping is also how we acquire immunity through vaccinations. The immune system is triggered by typically a small amount of protein from a virus that in a vaccine, the piece of protein usually isn't going to cause any serious illness, but it is going to cause your immune system to have a reaction. And your immune system reacts in all the ways I've outlined, and eventually goes through the process to activate the acquired immune system to enable the body to launch a full immune attack to kill off the virus in any future exposures, because it's going to keep record and it's going to have memory of that virus and of that protein. So what we are exposed to in our lifetime dictates our acquired immunity. For example, where we live, vaccinations given at birth, and our exposure to different environmental conditions all impact our ability to fight off various diseases. So if you've ever experienced illness or allergies when visiting someplace for the first time, this is due to the exposure of something your system is not already familiar with. And next time you visit that place, you may not have the same reaction, for which you can thank what? Your acquired immunity. Because if you went to a new place, you were exposed to a new bug or a new virus, and you got ill, you got over it, you go home, and then you go back to that same place, which you're not that familiar with, but you'd been there before, and the same type virus is you're exposed to this time, that time you will not typically get ill, let's say. So these are examples of the acquired immunity and memory. Now, because we are all exposed to different pathogens or antigens, we all have unique, individualized immune defenses. This means immune systems vary from person to person. While we all have similar innate responses, such as a skin barrier, our acquired immunity can be vastly different. In fact, recent studies have found that our history and our environment, like where and with whom we live, are responsible from anywhere between 60 and 80% of our individual immune system strength, while genetics account for only about 20 to 30% of our immune system strength. And this whole concept is called epigenetics. You may have heard that term before. Epigenetics means our environment's effects on us and on our genes, and in this case, on our immune system's function. Now, an overactive immune system can result in a number of conditions, including allergies and autoimmune diseases. Allergic diseases include allergies to foods, medications, or stinging insects, things called anaphylaxis, hay fever, sinus infections, asthma, hives, dermatitis, and eczema. These conditions result when the immune system makes an overly strong response to an allergen. And as we mentioned earlier, this type of overactivity is due to the Th2 branch of your adaptive immune system. So, one more point to make. Autoimmune diseases include multiple sclerosis, autoimmune thyroid disease, type 1 diabetes, systemic lupus, rheumatoid arthritis, systemic vasculitis. When the immune system mounts a response against normal components of your own body, autoimmune disease is to blame. This means a person's own immune system attacks self. And as mentioned earlier, this list of conditions that are considered not allergy, but definitive autoimmune diseases are due to overactivity of the Th1 branch of the adaptive immune system. An underactive immune system, also known as immunodeficiency, does not function correctly and makes people vulnerable to infections. And this can be life-threatening in severe situations. Immunodeficiency can be inherited and include rare conditions with some names like common variable immunodeficiency, X-linked severe combined immunodeficiency, and complement deficiencies. Immunodeficiency can also arise as a result of medical treatment or can be caused by another disease, such as we're all familiar with the HIV or AIDS, which is an acquired immunodeficiency disease, and certain types of cancer can also put someone into a situation of immunodeficiency. So what can we do? Now that you have a more in-depth understanding of the immune system and how it works to protect us, let's take a look at ways to strengthen your immune system. And the ability to boost immune function is complex and continually being researched and understudied. It requires a balance and harmony among all the parts of the immune system. The interconnectedness of the immune response is very complex. So let's take a look at the effects of lifestyle being researched to give your immune system a boost. Now, your first defense, folks, and always, I mean, this is what functional medicine is all about. Your first defense against any chronic condition or any infection and for your immune system is to live a healthy lifestyle day in and day out. Not only will your immune system benefit, but every part of your body will function better by following the following tips. And these are research-based tips, folks. Number one, obvious, do not smoke. 2, eat a diet high in fruits and vegetables. Exercise regularly. Maintain a healthy weight. If you drink alcohol, drink only in moderation. And the recommendations through research are for women to drink 1 alcoholic beverage per day and keep it to that limit, and men 2. Get adequate sleep. Take steps to avoid infections such as washing your hands frequently, and of course, minimize as best you can stress. It has been well established that people who are malnourished are way more vulnerable to infectious diseases. Another group of individuals who are susceptible to micronutrient malnutrition are actually the elderly. This is because older people often have less variety in their diets. Micronutrient deficiencies, for example, deficiencies of zinc, selenium, iron, copper, folic acid, and the vitamins A, B6, vitamin C, and vitamin E are particularly important for your immune responses. If you suspect your diet is not providing you with all your micronutrient needs, then add variety to your diet by eating what I call the rainbow. Fruits and vegetables of all the colors of the rainbow: red, orange, yellow, green, blue, purple. If you look at the slide and you see the different colors of the different things on the tray there, you'll notice it takes on the colors of the rainbow. Foods of different colors have different vitamins and minerals in them. Once eating a healthy diet, then as a supplementation to your diet, taking a daily multivitamin and other mineral supplements may also help increase the power of your immune system. But remember, your diet comes first, and supplements are exactly that, a supplement to your diet and your overall healthy lifestyle. Now, chronic stress is common in today's society. I mean, it's becoming more and more impossible to avoid it. Our busy schedules and packed social calendars and social media and insanity of our technology today demand from us more time and more efforts to stay on top of things. And it is more than any other time in history. Other stressors, such as financial burdens and anxiety, all contribute to our chronic stress. And when we experience stress, hormones are released in your body. Cortisol, adrenaline are two big examples. This is helpful when we're in danger and need to flee to safety. However, again, when under chronic and constant stress, these hormones remain present throughout the entire day rather than going up and down. And the result of chronic stress leads to a never-ending list of diseases and illnesses ranging from depression to heart attack to chronic immune irritation and hyperactivity. So during times of stress, the immune system may also be inhibited. Therefore, regularly participating in stress-reducing activities is not only beneficial to overall health, but general immunity as well. And of course, at Discover Health Functional Medicine Center, we have numerous programs that could help you with all of these things, such as our Discover Health Movement membership program, which has a yoga class. It has a self-myofascial release class. It has a balance and strength class. But all of those classes are meant not only to keep your body in shape and help you exercise, but also to help you forget all the other stuff in your world and quiet your mind and quiet your being and reduce your stress. So I know we covered actually a lot of material here in a pretty short time. I'm happy to take any questions in just a minute. So go ahead, and of course, if you haven't already typed type a question in the chat. And of course, if you need more time to let it sink in, that's okay too. And as we usually do, the references for this talk will be listed tomorrow on our Discover Health Facebook group page, or area of Facebook. So if you want to do some further reading on your own, you're able to. Now, remember, if you are interested in that and you're not already a member of our Discover Health Facebook group, all you do, if you do go to Facebook, is go to our Discover Health Functional Medicine Center Facebook page and request to be a member of the Facebook group. It's a closed group because that's where people can ask questions and we can have feedback back and forth. And that is where we typically list all the resources. But also, if people were interested that don't do Facebook, there are other avenues that we can get you the information. So thank you all so much for taking the time out of your busy day to join us for this experience. The topic of immunity is vital to health. The more we know about how the body works, the better equipped we are to defend ourselves from disease. If you think of any questions in the future, you didn't think of them and ask them in just a moment tonight, please contact us at discoverhealthcoaching@gmail.com. And if you'd like to learn more about your health, you can always schedule a consultation with our highly skilled team by calling 603-447-3112. So now it's your turn to see if you have any particular questions. So I'm going to stop sharing the slides and bring my video back up. And I'll bring up the chat. I see there's a couple things here. How do vitamins and minerals help power the immune system like vitamin C? How do anti-inflammatories work with the immune system? If you take them for an inflammation, does it calm down all inflammations in your body while you are taking them? Okay. So first of all, the immune system is supported. Many biochemical pathways and pathways of the immune system are supported like by chemical reactions that we talked about. And most chemical reactions are going to happen with cofactors. So if this chemical A wants to interact with chemical B, there's a cofactor that can also boost that reaction and that chemical reactivity. Vitamins such as vitamin C, vitamins such as many of the B vitamins, and many others act to stimulate these reactions and help them to happen more quickly or more efficiently. So that's where the vitamins and things come in. Vitamin C is very well known to reduce inflammation in the body also. So again, these are, in order to go into every single vitamin and mineral, it would take, a textbook. But the bottom line is vitamins and minerals support the reactivity of the immune system, and particularly vitamin C is well known for that. Now, anti-inflammatories, I assume you're referring to the anti-inflammatory medications like Advil, Motrin, Aleve, those types of things. They act to block the immune system's inflammatory response. So if you have a fever, for example, you can take sometimes those things to drop fever. Tylenol is not an anti-inflammatory, but that's also an anti-emetic, meaning decreases the inflammatory response. So that's why inflammatories happen. But remember, though, that in an acute response, sometimes we don't want to take anti-inflammatories at first because you want the acute inflammatory response to be happening. And many times we may only take an anti-inflammatory because the inflammatory response is so uncomfortable. Like I had my first, I think it was my first COVID booster. And I just felt horrible afterwards, to the point that I needed to take some Tylenol to handle the level of inflammatory reaction my body was having. So I did take some Tylenol in that case. Now that was, again, Tylenol is in it, lowers your inflammatory response, lowers fever. Anti-inflammatories block inflammation. Does drinking enough water help with the process? Absolutely. To flush out, think of it, we talked about membranes and mucus. Mucus can trap some of the bacteria or the viruses. It can trap particles of the foreign invader. And then the more you wash out your different systems, like your GI tract with water or your urinary tract with urinating and going through all the system there and cleaning out the bladder regularly. And this is another reason why like a neti pot or a sinus rinse bottle is good, because it washes your sinus membranes and will take away the mucus and get the stuff that's stuck in the mucus there out of your system, rather than letting it stay there and possibly continue to cause a problem. So those were the things I see in the chat. Does anyone else want to unmute and ask any particular question? All right. Well, if there aren't any further questions or comments, then thank you for coming this evening. And I
Chris,
hope, yep.
I have a question for you. I'm sorry, it's Patricia.
That's fine.
How does exercise, other than stress reduction and the other good things exercise does that help boost the immune system in any way? So how?
Well, first of all, exercise improves blood flow. Exercise will obviously improve muscle mass and proteins are utilized, as we said, as enzymes. So the more muscle, people as we age, for example, if you develop sarcopenia, meaning muscle wasting, that makes you more immune deficient also. So to exercise and have a good structural support for your immune system is very important. Exercise, again, also improves blood flow. It also moves the lymph. Your lymph system is part of your immune system in creating antibodies against infections. So the more we move and squeeze the fluids of our body through our body, the more effective and efficient those systems are going to be able to be.
Okay, thank you.
Sure. Anyone else? Great. Well, thank you all for coming. And I hope everyone has a wonderful, wonderful holiday season. And we'll see you in the new year. Take care, everyone.